everyone, so in this video, I will talk about an article from The Lancet written by Angela Saini in 2020. The article discusses how stereotype and racial assumptions in medicine can affect healthcare and medical research, especially during the COVID-19 pandemic. So, during the COVID-19 pandemic, many reports show that ethnic minorities in the UK and the USA experience higher death rates and more severe illness. For example, in Chicago, a large percentage of COVID-19 deaths were among Black residents. In the UK, non-white patients also made up significant numbers of serious COVID-19 cases. Because of the statistic, some researchers began suggesting that racial or genetic difference might be the reason. However, the author argues that the issue is much more connected to social inequality than biological. The article explained that race is mainly a social category, not a biological one. Even though medicine often group people by race and ethnicity, this category do not always reflect a real genetic difference. According to the author, humans are genetically very similar overall. Difference between individuals are actually greater than difference between racial groups. Therefore, using race as a biological explanation in healthcare can be misleading and scientifically weak. One important issue discussed in the article is racial stereotyping in the medicine. Doctors and researchers sometimes assume that people from certain racial groups naturally have certain health conditions. For example, Black patients with hypertension are often given different treatment compared to white patients. However, study mentions in the article found little evidence that race-based treatment is actually more effective. This shows that medical decisions based mainly on race can create unfair treatment and strengthen harmful stereotypes. The author believes that social and environmental factors play a much bigger role in health inequality than genetic. Factors such as poverty, racism, discriminations, stress, poor living conditions, and limited access to healthcare strongly affect people's health outcomes. The article also highlights the high death rates among Black women during pregnancy and childbirth in UK and the USA. According to the author, this problem linked more to unequal treatment and healthcare system than biological difference. The article explains that conscious and unconscious bias still exist in healthcare. Sometimes doctors might not realize that stereotypes influence the way they treat patients. Women and minority groups are often not taken as seriously when reporting symptoms or health problems. As a result, some patients receive delayed treatment, incorrect diagnosis, or lower quality care. The author warns that medical research should be careful not to confuse social difference with biological facts. The main message of the article is that racism, not race itself, is responsible for many health inequalities. The author believes that healthcare systems should focus more on improving social conditions and treating patients as individuals rather than relying on racial assumptions. She also argues that medical research must avoid maintaining stereotypes because they can negatively influence healthcare decisions and public understanding. So, in conclusions, the article shows that racial categories should not automatically be treated as biological explanations in medicine. Health disparities are more closely related to social inequality, discriminations, and unequal healthcare access. The article encourages medical professionals and researchers to move towards fairer and more personalized healthcare than focus on individuals instead of stereotypes. So that's all for my presentations. Thank you for watching and I hope you enjoyed this video and learned something new from it.